Welcome back to Can You Hear Me, a podcast about hearing, hearing loss, and everything in between. I'm here today with Dr. Nicole Jiam, otolaryngologist at the University of California, San Diego. Dr. Jiam, thank you so much for joining me today.
Thank you, Rishi. It's a pleasure to be here today.
Yeah, and it's a pleasure having you on the podcast. So, to start things off today, can you tell me a little bit about your research? What part of otolaryngology have you focused on in your work so far?
Yes. Well, I'm so glad you asked this question, Rishi. As you mentioned, I am an otolaryngologist and neurotologist. So a lot of my clinical work and also my research work centers on hearing, the ear, and skull base. So my research program has largely focused on cochlear implant outcomes and how does the brain adapt to these prosthetic devices. Fundamentally, what I'm trying to ask is why two people with the same implant may have very, very different real world experiences. And sort of the crux behind what I'm doing is my work has elucidated and focused on other measures that are better able to capture the real world situations and the full picture of what hearing sounds like using music as a cue that is much more sensitive in capturing the nuances and the accuracy levels that real world setting and hearing perception requires in order to do well in their everyday world. So our lab uses a variety of different methods, anything involving the ear with psychophysical listening tasks and behavioral measures of what they're perceiving, to EEG and brain measures of how the cortical central functions are occurring and the neuroplasticity that might be occurring with their attention and cognitive effort, to other various aspects of machine learning and computational modeling to really try to understand how do these different trajectories and phenotypic profiles emerge after they're implanted. So we use a variety of different methods, and with the idea that the whole listening experience is not only from just one domain, it's from multiple domains in the human body and the environment.
I think it's really interesting how you've been able to juggle all of this research with all the other things that you do, because unlike a lot of other medical professionals who restrict themselves to, maybe only clinical work or only research work, I feel like you've done a lot of stuff outside of that. And one of these is a company you founded called IIAM Health. So I'm curious, what inspired you to start that company and what have you done with it so far?
Yes. Well, I love talking about IAM Health, and I'm so glad that you also asked about this question because I think fundamentally all the things that I'm doing become like very synergistic because it's what directly connects me to the patients and both short term and the long term work of how we're pushing the field forward. So the origin of how I started working on IAM was that I noticed from my own clinic patients and my patient encounters was that there was a gap between when a patient needed specialized care, for instance, seeing an ENT surgeon or even seeing a neurotologist like me, and when they were able to actually reach the right specialist. Referral triage, getting to see a specialty doctor right now is a very slow, manual, and inconsistent process that is largely managed by front office staff that may or may not have very little medical training. And so, as a result, patients can fall through the cracks. And a short example of it is a patient who may have a growing mass on their neck that could actually be cancer, but they have to wait weeks and see multiple providers before someone actually realizes that they should have been seen by an ENT doctor with a specialty in head and neck cancer. So the way that IAM works is it's an AI machine learning company that focuses on intelligent patient referral triage, getting the patient right to the right provider at a much faster and efficient manner. So we've been really excited about this because I think it's a way to use technology in a way that really helps improve patient outcomes and improve clinical efficiency without kind of sacrificing the kind of quality of care that we're providing to our patients.
Really beyond just neurotology or even otolaryngology. This is for all specialties. Is this like a software package that gets deployed at, hospitals around the country? Is that the end goal here?
Correct. You are right that it is bigger than otolaryngology. It is a problem that is endemic to healthcare, not only within the US, but also outside of the US. And so, it's been really exciting to see the problem from inside the clinic and feel empowered that we're working on a solution that can really help transform the field. And we are deploying this software across different hospitals, across different specialties, across different care models.
It's really interesting how you've, kind of taken your experience, your clinical experience, and you're kind of translating it to a much larger thing, which I think is awesome. For every guest on this podcast, I obviously have to do a lot of digging to figure out what questions to ask. And I think the most digging I've ever done for someone is for you, just because I found your profile so interesting. And one of the things that I saw was that you were vice president of the San Francisco Opera Bravo. So, what made you take up that position? I know you mentioned music before in your research, and I also saw that you did a lot of music when you were in high school too.
Yes. You're exactly right in that my love for music has really emerged since once I was a child. And it's a big part of why I was interested in auditory neuroscience and why I even discovered the field of otolaryngology and then naturally pursued a clinical specialty where my focus has been about hearing and the way that our senses can alter the way that we perceive the world. And so, a natural inclination, a natural hobby of mine is to listen to music and go to concerts. And, for instance, one of the beautiful things about San Francisco as a city is that it has a incredible San Francisco opera. So when I moved to San Francisco, I started getting involved with the opera and the broader community. And Bravo is San Francisco Opera's group for younger patrons and professionals. And the idea is that it's trying to build the next generation of opera audience and enthusiasts and keep the art form vital, but also contemporary and evolving with the times. So not constantly always going back to the classics that we know, but also bringing in new artists and emerging ways of which music and opera can be delivered. So it's sort of the idea that science can meet art. And it's a way that my love for music has evolved over time from being a musician myself to studying music to caring for patients that maybe have lost their connection with music to also figuring out how can I engage in the arts world in a larger community. And that's something that I've been very, very passionate about and keeps me going.
Yeah, I mean, I think it's great to have all of these diverse experiences. And I think just for myself too, because I'm also involved in a lot of music stuff and I play for two orchestras, I've really seen that doing those activities has given me kind of a different perspective on the auditory sciences. Well, thank you so much for joining me today, Dr. Jim. It's been great having you on the podcast.
Thank you so much, Rishi. It's always wonderful to talk to another fellow enthusiast for not only hearing loss, but also a musician themselves. So, again, it's an honor to be here, and thank you again for your time.